I'm asked fairly often, how much coverage do I really need when looking at an Affordable Care Act plan? And there's not a simple answer for that because it's based on how much medical care you think you might need during the year and how much of a risk you want to take. So there are 4 types of plans in the Affordable Care Act: bronze, silver, gold, and platinum. Bronze plans have a lower monthly premium and higher cost-sharing amounts. So that means deductibles, coinsurance, copays tend to be higher with bronze plans. Silver plans, kind of right in the middle. There's a median premium and then cost sharing right in the middle there. Deductibles vary. Some of them are higher, some of them are lower. Gold plans has a higher monthly premium, but then tends to have lower cost sharing. And then platinum plans has the highest monthly premium and the lowest cost sharing, deductibles, coinsurance, copays when you actually go to see a doctor. One additional thing to think about too is how much of an advanced premium tax credit you get and if you are eligible for any cost sharing reductions. If you are eligible for cost sharing reductions, that means that you get help paying at the deductible, insurance, and copay level. It's not like you get a check or anything. It's built into the plan that you have lower payments when you use services. So if you get cost sharing reductions, it makes a lot of sense to look at a silver plan. Because if you're getting cost sharing reductions, it also means you're getting an advanced premium tax credit. And a silver plan might actually be the cheapest plan. So look at all your options. Don't just look at the cheapest monthly premium ones, because as you scroll through the pages, you'll see a huge variety of the way plans are structured and the kind of networks that they have. So pay attention to that also. So when you're looking for a plan and asking yourself, how much coverage do I really need? You have to think about first, how often you're really going to use a plan. There are people out there who never use their insurance, especially younger men, tend to maybe go in for their annual flu shot, if that, or maybe they get it at a pharmacy somewhere. So they're really not using the insurance all that much. They just need something to qualify as full insurance and to avoid the tax penalty, and they also just need something for emergencies. So in those cases, a bronze plan, maybe even a catastrophic plan for someone under 30 makes a lot of sense. But for someone who goes to the doctor a couple times of the year fairly often, or knows that they need some sort of routine care, a silver plan can make a lot of sense. And the cost sharing, so the deductibles, coinsurance, and copay really varies by plan. So take a good look at that before you click enroll in a plan. Understand what you're actually buying, because it does vary greatly. So if you need to go pretty routinely and feel more comfortable being able to go routinely, not just in an emergency, silver plan is usually a really good choice. For someone who knows they need a lot of medical care, or like the security of knowing if they needed it, they wouldn't have to pay a whole lot out of pocket, or they wouldn't have to get a big bill, a gold plan or a platinum plan can work really well. So the answer to how much coverage do I really need is based on, first, what kind of medical care you'll need in the year, your best projection of it. And then the second thing to consider is, can you really afford the monthly premium? And how comfortable do you feel with a high deductible? So when you pick a bronze plan, usually means you have a higher deductible. So for those people who rarely go or never go during the year, just get their preventative cares done, a bronze plan can be great for that. But then if they do have, let's say, God forbid, an accident, they have to go to the emergency room and, have some procedure done there, they're going to see a fairly hefty bill for up to their deductible amount, possibly up to their out-of-pocket maximum amount. And some people are really uncomfortable with the idea that, yes, I don't go to the doctor very often, but if I had an accident, I wouldn't want to get a fairly big bill. Some people are comfortable with that and they'll say, okay, I'll just risk it. It's not worth paying extra premium amount for the extra coverage if I'm only going to use it in the case of an emergency. Whereas other people feel much more comfortable with, say, like a silver or a gold level, where they're paying a little bit more for a monthly premium, but they know if they did need to seek care of some kind, or if there was an accident, the bill wouldn't be as large. So pay attention to the cost sharing of the plans, not just the amount of the monthly premium. I highly recommend you get some professional help with it. You can contact an agent or broker such as myself. We can actually give you advice on the plans, or you can work with a navigator, a certified application counselor, or the folks at healthcare.gov. If you call their 1-800 number, they can give you information on the plans. They can't give you advice, but they can help go through what the cost of each plan would be. So if you do need help, and you live in Wisconsin, please feel free to contact me. Otherwise, you can do it all yourself on healthcare.gov or seek out a navigator or a certified application counselor. All of the services I just mentioned through an agent or broker or another assister, they're all no cost to you.